It's so good to be a doctor. This patient had a chest tightness. The doctor suggested an electrocardiogram. Then she took her shirt off. The doctor startled when he turned around. His reaction made the patient burst into laughter. After that, he called another doctor to help. 2 days later, they had the test result. The patient's heart rate was quite weak. However, the patient said there was no change in her diet and daily routine. Dr. House understood the problem. He asked, "Does your husband have high blood pressure?" 6 months ago he was diagnosed with high blood pressure, she answered. "Does he often cook?" "He only makes breakfast." House understood. The patient said that she once had a breast implant to celebrate her husband's 40th birthday. However, her husband had reduced his sexual desire because he was taking antihypertensive drug. Nevertheless, he didn't want to upset his wife, so every morning when he made breakfast, he put a small amount of antihypertensive drug inside, so that both of them reduced sexual desire. After hearing that from Dr. House, the patient asked, "What should I do?" Dr. House then replied, "For your husband's sake, you should consider going to a bar. He's such a dedicated doctor." Aside from this patient, House had another patient. The initial symptoms of this patient were insomnia and high fever. She had to sleep 18 hours a day and were very irritable. She could easily get angry and slap her husband. She then was taken to the hospital. After some checkup, they didn't find anything unusual in her blood. It might have been in the brain, but both of her CT scan and MRI showed neither tumor nor any inflammation. Robert thought it was because of parasites, but Allison said they didn't find any parasite in the patient's blood and marrow. Being unable to find the cause of the disease meant that she couldn't be cured, making her husband very worried. At this moment, the patient lost consciousness and had a violent convulsion. Dr. Wilson suggested that it could be paraneoplastic syndrome because her family had a history of breast cancer, but after examining, the doctors didn't find any sign of the cancer. House asked Eric to go to her workplace to check if there was anything that could poison her. The patient was a chef at a barbecue restaurant. Eric went there, but he found nothing unusual. Looking at the rabbit on the kitchen, he thought it could be liver disease, but the infected would have respiratory problems, but this patient didn't. House thought of African sleeping sickness. In the later stages of this disease, all the parasites would gather in patient's brain. That's why they didn't find any parasite in her blood and marrow. But there was a big question. The patient had never been to Africa. How could she be infected? Allison said, "If I were you, I would take a risk and started treating her." Robert said, "Treating liver disease will lead to non-generating anemia, and the mortality rate of African sleeping sickness was 10%. Other doctors wouldn't dare take risk, but House wasn't a normal one. He told his assistants to ask the patient and her husband whether they had committed adultery with anyone, because blood-borne diseases could be transmitted through sex. So could African sleeping sickness. The assistants were very hesitant, but still followed what he said. However, both of them denied doing that. So they rejected the possibility of African sleeping sickness because there was no source of infection. Allison was allowed to cure liver disease for the patient, but not long after, the patient fell into a deep coma. They couldn't wake her up and she couldn't even feel pain, which meant it wasn't liver disease. Dr. House checked her up again and made sure that it was sleeping sickness. One of the couple lied to them. The treatment had 10% of mortality rate, so the consent of the patient's family was required. The husband had no other choice, but a question arose in his head. If they could cure her wife, it would mean she had an adulterous relationship with someone, but if they couldn't, his wife would be in danger. He didn't know which result to be worth expecting. After being treated, his wife got weaker. The husband sat beside her bed and burst into tears. Suddenly, her pulse returned to normal. She regained consciousness, which meant it was African sleeping sickness, and at the same time, he had to accept the truth that he was cuckolded. Dr. House turned around and walked out of the room. The next day, the husband packed up and said goodbye to his wife. Seeing the patient cry, Allison ran after him and asked, she would rather die than tell the truth about her cheating on you, which proves that she still loves you. Isn't that enough? But the husband still decided to leave. Were you him? What would you do? It's the end of the movie today. See you in other videos.